early identification or prediction of preterm births can be accomplished by doing a transvaginal sonographic screening of cervical length, and this can be done in pregnancy, and especially we must understand the management of such women who are then presenting with a short cervix. So the question is, when and how often should cervical length be measured? Now, in a patient who has a singleton pregnancy with no prior spontaneous singleton preterm birth or twin gestation, we can consider a single transvaginal measurement of cervical length at approximately 20 weeks of gestation between 18 and 24 weeks. And if the cervical length is found to be more than 25 millimeters, then we can consider taking her for a routine and prenatal care. If it is found to be 25 millimeters or less, then one can consider her progesterone therapy, either a natural micronized progesterone or 17-OHPC weekly, or vaginal progesterone given daily through 36 weeks of gestation, and there wouldn't be any requirement of additional cervical length assessment. Now, if it is a singleton pregnancy with a previous spontaneous preterm birth or a mid-trimester pregnancy loss between 14 to 27 weeks of gestation, then consider transvaginal measurement of cervical length at 14 weeks of gestation, and if it is found to be equal to or more than 30 millimeters, then repeat the measurement every 2 weeks through 24 weeks as long as cervical length remains more than or equal to 30 mm. If it is 30 mm or less, then and triage it further. If it is 26 to 29 mm, then repeat the measurement weekly through 24 weeks as long as the measurement remains 26 to 29 mm. If the measurement is less than 26 mm, then place a cervical cerclage and continue either NMP progesterone or 17-OHPC progesterone. If one has a singleton pregnancy with previous spontaneous preterm births at 28 to 36 weeks of gestation, then do a transvaginal measurement of cervical length at 16 weeks of gestation and triage it further. Like if it is found to be more than 30 mm, continue surveillance through 24 weeks till it continues to remain 30 mm every 2 weekly. If the cervical length is found to be less than 26 mm, then you can consider doing a cervical encircling progesterone therapy. If it is found to be more than 29 mm, then you can continue closer surveillance till it continues to remain at the same length. So, it is important to rationalize and improve the understanding of correct transvaginal sonographic assessment and triaging in pregnant mothers to identify cervical shortening and offer them the useful therapy given judiciously in the form of cervical encircling, natural micronized progesterone and 17-OHPC.